in Siddhartha Medical College, Vijayawada. I completed my MBBS in 1996. During that time, I think third or fourth year of my MBBS course, one of my friends, he's junior to me, this like meditation. I think I thought this is something ridiculous at that age to practice a meditation. So initially I refused bluntly. Meditation is only for the old people, not for the younger generation like us. So I felt in a different way, I think. But whenever I met him in the morning, afternoon, and during dinner time, so he used to tell me there's the importance of the meditation. At that point of time, I thought I can just do something, some experiment on the meditation. So with that intention, we started the meditation in 1994, a group of 5 people. I think all of us are the doctors. So all of them are great masters. I think they have individual experiences in third eye, astral travel and all those things. So a span of 2 years of our ignorance, we will not believe that. But spirituality always a system that whenever you believe that, you will see that. But science is different. Whenever we see that, we believe that. But when you believe it, you will see it. That is a spirituality. So with that intention, we studied 2 years of this spiritual science. And before we start that one, just Dr. Patriji was he's not a doctor, but Patriji one day he just shouted back as for killers. I did not realize what exactly this meaning of that one. But after a discussion of a couple of hours with him, we went to Karnool only to know that why he said that doctors are killers. But with the way discussion is existing, but we are not believing that. With that and intention, again we have started this experiment. So for 2 years we did not take, I think we vigorously we tried not to use the medicine. Just now morning sir said, Karthikeyan sir, whenever we get some headache usually or fever, we'll give or we'll take only paracetamol tablet. We never try to evaluate the reason for this headache. But our perspective has changed a lot. So with that intention, we did not use a single medicine for 2 years as this medicine. How you can balance these two systems? So I said, definitely we have to balance these two systems. Then only we can fulfill our life goal. So God has given a chance to become a doctor, but we can't refute our doctor profession. So we have some meaning in our life. So with that intention again, so nobody will choose this medical oncology. Medical oncology means it's a cancer specialty where we will give the chemotherapies. So cancer patients are entirely different compared to all other patients. Once the patient was diagnosed to have cancer, he thinks that a death sentence. So they will have the fear of death. So not only physical problem, there is so many problems will come into the picture, like physical problems in the sense, once we give the chemotherapy, they may lose their hair, cosmetic disfigurement, physical problems. Next, they will have this nausea, vomiting and loose motions, fever, bleeding. Yeah, I'll tell you some of the recent drugs. I think with that we can overcome that one, but some of the drugs still we have those side effects. Next, financial trauma. Usually most of the patients, they may not afford this so-called treatments now. And third one is the family. So if a kid gets the cancer, whole family get disturbed. Whether they have to take the patient to the hospital, nearest hospital every week or every day, sometimes they have to be there in the hospital. So many problems are involved in this. So I'm a medical oncologist. I have some experiences in the cancer management. If we have this positive attitude towards our disease, not only cancer, any disease, definitely we can get the miracles. So the morning, Dr. Karthikeyan sir, he says that nobody knows, everybody has to die, but nobody knows when to die, how to die. But cancer patients, they know that definitely they are going to die within 2 or 3 months. Usually we will dictate that you will survive only for 6 months, you will survive only for 9 months. But that is our only physical, our experience. But we have so many miraculous recoveries. with their positive attitude, with their